All right, hello everyone, and welcome to another day of the second wave of the pandemic, science and society. Today we have a special event in partnership with the Department of Anthropology at Washington University in St. Louis. We have Sammi O'Reilly with us today, who put together this excellent panel on global health and COVID-19, and she will be moderating the panel. So I would like to welcome her and all of the panelists. Thank you very much for being here.
Thank you so much for everyone joining today, particularly Dr. Milich for allowing us to use this space to engage in this important discussion. This is sort of the accumulation of about a year of planning, research and work on my behalf in partnership with Medicine and Society and the Department of Anthropology. So I'm really looking forward to today's discussion to address how global response to the COVID-19 pandemic has evolved over the last year and where we perceive the direction of future response heading. So this panel is again something I'm really incredibly passionate about, and I'm very much looking forward to hearing the insight and perspective of all of our panelists today. I've asked each panelist after I introduce them to begin with a brief sort of 2 to 3 minute background on the general status of pandemic response in their respective countries or regions of expertise. So as the audience, feel free to direct specific questions their way as it relates to their context. So without further ado, I will go ahead and introduce them because we have so many questions to get through. I'm very excited. First is Dr. Catherine Hankins. Dr. Hankins is a professor of public and population health at McGill University, the Deputy Director of Science at the Amsterdam Institute for Global Health and Development, and the co-chair of Canada's COVID-19 Immunity Task Force. She chairs the Scientific Advisory Committee of the European and Developing Countries Clinical Trials Partnership and the Scientific Advisory Group of the U.S. National Institutes of Health HIV Prevention Trials Network. Welcome, Dr. Hankins.
Thank you. Great to be here with this stellar panel. Do you want me to speak a little bit just for a couple of minutes about what I'm doing and where things are at, or should we do all the introductions? Okay.
No, go ahead.
So Canada is actually in wave 3. We call it wave 3 here. It's the worst wave of we've had 2 other waves. This is the worst one. So we had our first wave in the beginning. We had our second wave in the fall. This is our third wave, and we have a lot of circulating variants. We're very concerned. We've got 117, B117 is taking over in most provinces. In the West, in British Columbia, we have P1, which was the one originally discovered in Brazil. We have a vaccine rollout going as fast as we can, given that we have no biomanufacturing capacity ourselves. We've had to purchase on the international market. We're kind of accused of hoarding because it looks like we're getting way more vaccines than our population size, but they certainly have not been delivered yet. So right now we're using, it's called a first doses fast strategy, and I'm happy to talk about it in a bit. But we're using a 16-week interval between the first and the second doses in order to get as many people with a first dose as possible. We will loop back to the people that are very vulnerable, our seniors, people with cancer or immunodeficiencies. We won't go as long as the 16 weeks, but the idea is to suppress transmission as quickly as you can and stop the transmission of these variants and the creation of these variants. And all of the approved 2-dose vaccines have really good response after 1 dose. So this is our pragmatic strategy that we're using here to try to get ahead. And I'll finish right there just to say where we're at is certainly not anywhere near where the US is. In fact, our per capita case rate right now is higher than the US's, which is really concerning. We have 2.2% of the population fully vaccinated with 2 doses. We have 21% that have at least 1 dose. So that's just to give where we're at. We're in lockdown in many places. There's a curfew where I am for 8 p.m. every day. We have schools that are closed. So we are not in a good situation at the moment.
Absolutely, and we will be addressing sort of specifics of vaccine rollout and distribution. A lot of student submitted questions were interested in this area in particular. Thank you, Dr. Hankins. Next is Dr. Rana Dejani. Dr. Dajani is currently a Cmalakova Fellow at the Jepson School of Leadership at the University of Richmond and the President of the Society for the Advancement of Science, Technology, and Innovation in the Arab World. She is a member of the UN Women Jordan Advisory Council and was awarded the Jordan Star of Science by His Majesty King Abdullah II. Welcome, Dr. Dajani, today.
Thank you very much. It is so exciting to be here, to learn, to listen to everybody from the panel and from the students, and through these interactions that we can grow together and share information. So I'm going to talk about Jordan because that's where, although I'm living in the US for this period of time, but obviously I'm in Jordan through Zoom practically every day. So I'm going to share what has happened there throughout since COVID and the pandemic was announced, and look forward to listening more and hearing from the questions. I'm not going to talk about statistics and numbers. I usually leave that to the internet to keep my mind free for something else. However, we just published an article last week in Cell Med Press, and I'll share the link, and people can actually go there and read about this recent review about the status of COVID-19 in Jordan. But briefly, Jordan is a small country and it represents other Arab countries in the region. And I'm sure many of you are familiar about the political turmoil in the region. Jordan is host to refugees since it was established. So we have the Palestinian refugees who have come in multiple waves. And then we have the Iraqi refugees who came from the 1991 and then 2000. And then we have the last 10 years of the Syrian refugees who have come to Jordan. So Jordan is really a patchwork of refugees or those who have become Jordanian citizens. And because of that, we have limited resources on every level, whether you're talking about fundamentals like water or more because of the economy. But we have been doing pretty well considering the situation. And as Catherine mentioned, there are, one can say, 3 waves. However, for us in Jordan, the first wave, when COVID first hit, immediately the government took measures because we have a very advanced medical health system in place. We have the expertise and we have all the scientists and the physicians. We did a total lockdown, which saved Jordan for that first wave. So we were one of the lowest countries in terms of cases, in terms of deaths and so on. Like we were counting 1 or 2 deaths in days. But then eventually you can't keep a lockdown forever. And then we had the fall when everything started opening and then the cases started to increase. However, that was when the first vaccines were coming through, and Jordan made a policy of vaccinating everybody regardless of your nationality. So refugees were being vaccinated and everybody, and it was more of a priority of your age and your medical condition. And the beautiful thing is how not just the government put in these regulations, they created task force from local people, experts, for different sectors, whether we're talking about the economy or we're talking about the health or education or technology, to come together to come up with new solutions for this unprecedented situation and circumstances. And so other than the government and the regulations and the lockdowns, we also had the civic society stepping up and helping out at different levels. And we can talk more about that later. But amazing stories came out of solidarity, of coming together, of protecting each other and helping each other, which we're very, very proud of. And I think this is the spirit that we've seen across the globe as well. And one last thing I'm going to say is I think with COVID-19, it has made the globe truly flat in the sense that and I hate using the word developed and developing, but we always look at the developed world as advanced and they have everything. But we have seen today, because of COVID, how the masses, the wider communities are really the same. And I'm proud to say that people in the developing countries have actually responded in a much more sometimes responsible way in practicing wearing masks, in going to take the vaccine, in washing your hands and things like that. And I think this is important to note. That humans are humans and that we can all help each other and we all matter. Every person matters today. If somebody has COVID anywhere in the world, we all should worry and take care of that person and work together.
Absolutely. Thank you, Dr. Dajani. We definitely will be circling back to the matter of task forces that you mentioned as well that translate to direct community response, because I think that is particularly relevant in how successful different methods of approach have been as well. Next is Simone Salamps. Ms. Salamps currently works as a part of the UN's Geneva Global Team as the Gender and Human Rights Advisor. She formerly worked as a Community Support Advisor for the UNAIDS Regional Office for the Middle East and North Africa, responsible for the Youth, Gender, and Human Rights Agenda. Simone is an Egyptian national with an academic background in social sciences and comparative literature who has worked on issues of reproductive health, occupational health, and health of the elderly since 1993. Welcome, Ms. Salam.
Thank you, Sammi. It's always a pleasure to be with you. And I'm really also, like what Dr. Rana said, I'm really looking forward to learning from this amazing panel and the students and the questions. As you said, I'm going to be speaking from different angles, being as an Egyptian, how this also has been impacting me living in Egypt right now and my family. I also am going to be speaking from the experience of the regional lens, having been in the regional office for regional UNAIDS office for 10 years and more, and also being the COVID focal point at the regional focal point. I also want to bring in the global perspective of where we want to go with this discussion, especially from the society and where we are, lacking when it comes to equality. And maybe for the students and for what I'm going to be speaking of is mainly where we felt stigma and discrimination, where we felt inequalities have really made it not very, let's say, not everybody was accessing services, not everybody is able to access vaccines right now. So I really want to speak from that angle, how human rights lens should be applied, or is it applied or not? The gender, lens also to our interventions. I want to also speak about some of the great experiences I have seen during the COVID with people who have been, stranded in countries when the pandemic hit, with lack of access to ARVs, for example. And I'm happy Dr. Rana is here because Jordan is one of the countries that supported some of the LGBT communities that were stranded there, and we really managed to get ARVs for them. We have seen how we could work really on this area when we had UN working with governments, with civil society across the region. I have to say that we did not manage to reach maybe except 1/5 of the people who are in need. I'm sure as we speak now, there are others who are stranded there and others are still in lockdown that maybe we are not aware of. And this is something that, of course, we all need to be cognizant of. So again, from the context of developed and developing countries, I want to also bring in the prospect that Egypt, as I'm speaking, had also had its own very interesting dynamic in responding to the COVID. So as much as we've seen the lockdown maybe has not been as strict as in other countries, but still we've seen so much happening in other, the country responding fast to some of the issues of gender equality and gender issues in terms of women, support to women, economic empowerment, some social protection measures. I also think within the HIV response, the multi-monthly dispensing was something we were all so happy to see. It happened in most countries of the region, and it was unexpected, especially that we did have some stock outs in many countries. I'm sorry I'm bringing in the HIV because I feel it's so much linked, and later we will speak to that as we go. But I'm just so happy to be here, and I'm sure as we speak, some more of these inequalities I would like to highlight are going to come out in my intervention. Thank you. Over to you, Sammi.
Absolutely, thank you. Definitely a lot of our student submitted questions as well have revolved around the intersectional nature of the impacts of the pandemic. So we will definitely be addressing those as well. But finally is Dr. Navid Madani. Dr. Madani is a senior scientist at Dana-Farber Cancer Institute in their Department of Cancer Immunology and Virology, with appointments at Harvard Medical School in the departments of microbiology and global health and social medicine. Her goal is to facilitate interdisciplinary scientific and health research and dialogue in the Middle East and North Africa region. Dr. Madani is also the founder and director of the Science Health Education Center at Dana-Farber, which aims to promote collaborative and capacity building approaches to relevant health issues in the Middle East and North Africa region. Welcome, Dr. Madani.
Thank you, Sammi. This is a wonderful privilege to be among the giants, really. Kate, I learn from you every day. Simone, is just wonderful to be able to collaborate with you as you go from Egypt to Geneva and work there. And of course, my sisterhood collaborator, wonderful scientist, Dr. Rana, and Sammi. You always a source of wonder for me. Thank you for inviting all of us and for this wonderful discussion. So I'm going to look at this, and I'm glad actually, Simone, you brought up HIV. I think between you and I and Kate, we can, kind of talk about the pandemic around COVID through the lens of what we saw in HIV during our careers. So with regards to numbers, as Rana said, I'm going to put that to Google, but what we know that in United States the vaccine rollout had bumpy start, but it's going really well, except that we are seeing waves that Kate mentioned in Canada, for example, in Michigan, and specifically in Detroit. I think they're seeing their third or fourth wave of pandemic really going bad, and also some pockets in the South as well. The instructions are that even though you are vaccinated, you have to be wearing masks still, because we really don't know. I mean, this is real-time science that's happening. The warp speed. A vaccinologist can tell you that we still need time to really figure out, what's the protection of this vaccine. Therefore, and especially since not everybody is vaccinated, we still have to be very, very cautious and wear masks. With regards to United States, I think as of last week, according to CDC, about 66 million people were vaccinated. I hope I'm right. With regards to other countries that, I have colleagues and also family members. The country of my birth is Iran, and I know they're in their double-digit lockdown phase this week, actually, again. Vaccine rollout has not been as, smooth as in other countries, neighboring countries, let's say. And this week has been very tough for people. And in addition, getting vaccines, especially for elderly, has been extremely difficult, long wait times. And vaccine, I think, is coming to them through, it's the Sputnik 5 vaccine through Russia. UAE has fared better. I think vaccine rollout was definitely better, and most of the vaccines they were using was mostly the Chinese developed vaccine as well as Pfizer. I'm gonna, with regard to where I like to kind of frame our conversation moving forward is definitely through the lens of science and scientific accomplishments in the past year and a half, as well as leadership. Countries that have had fabulous leaders, we've done better in those countries, let's say. And third, global health and global health cooperation. That's something that, unfortunately, my personal opinion is that we haven't done as well as we could have done. And I hope we learn from, this pandemic moving forward. I think I'm going to stop there and answer any questions.
Perfect. Thank you all so much. I think to start off, a lot of the questions that we received, as you all displayed, is that there is a lot of discrepancy between regional response to COVID. So perhaps, Ms. Salamps, you can start us off in sort of contextualizing what are the main factors that contribute to this discrepancy. You mentioned in your brief background, it relates a lot to inequity, discrimination. What are sort of the main factors that maybe contribute most to these differences?
I think when we are speaking about the COVID response, let's say from the start that we didn't all fare well. Let's say whatever has not been working in the society, this COVID came and made it worse. So, for example, if there had been some gender-based violence that we knew is existing so far in many countries, especially in developing countries, or in certain areas, it has been exacerbated by the COVID. If, for example, in this region, we have been seeing an influx of refugees, especially something that we had not seen since World War II, with so many countries affected either directly or indirectly, the situation for people most marginalized has been really, we've seen the worst of it because of the COVID pandemic. So if I may say, whatever has not been working, it has been doubled or tripled in terms of the impact of the COVID on the work, on the whole response. What I would also want to say is that it was especially challenging for human rights defenders. 2020 was a very difficult year for all of us. But I think what we could say, the disparities came from where we had civil society working, where we had communities that were very strong, and where we did not have communities that were very strong. So for example, when the pandemic hit, everybody was nervous. I think the whole world was like a kicked anthill. We didn't know where to go. And from the HIV response, we learned, or at least this is what we learned, is that there were already very well established communities, and these immediately took the lead, and they started, making sure that other communities who are more fragile are understanding what's happening, where you should go, for example, for this service, where you should go for this facility. So I think that also level of advanced, wherever we had advanced communities, we had better response to the COVID, whereas depending on the countries. This is from the regional perspective, I would say, as well as countries, like I said, who had, and I'm going to be speaking here also to all of the global response from the other angle where UNAIDS has been working. We've seen, for example, in Africa with the school closures. I mean, this has happened in everywhere around the world, but school closures have been affecting developed countries not as much as developing countries. For example, if school is closed in the developing countries, I don't think girls will go back. It might be affecting more that boys would go back, but girls may not. And by the time they go back, they would have lost a lot in terms of possibilities for empowerment or getting more education for their future. As I'm speaking now, we have 132 million girls who have been pre the pandemic out of school. Now 20 more are expected to be seen after the pandemic, and even 2.5 million, and I'm giving figures that have been really very hard for me even to digest, that would be susceptible to child marriage maybe by 2025. So it's really scary when we look at the gender aspect of it. But again, it's because from the beginning these inequalities have been there. The other thing I want to say, it's not really it's everything put together, but the I think the community lens has been very strong to be looking at the response from, as well as I would say the inequality in so small things. I could give you a very small example. You know how we all look at this mode of work after the pandemic, the modalities of like working from home, hybrid, all these terminology that we are becoming to think it's the world of work is going to be changing for all of us. But not all of us are going to be as lucky. As the pandemic hit, some of us were lucky to be staying home safe in our houses, protected, where others had to go out and work because the nature of their work had asked them to do that. And even after the pandemic, when we decide how we want to continue working, this is also going to be another disparity. Those who have not been lucky to be staying to be locked up when the pandemic hit will also be the ones who would not have the choice to be staying home and doing work from homes. And I'm just giving this as a small example. Disparities in accessing services through the internet. Not all of us had access to good internet. You see, so and for youth, this had been huge because it's a mental health issue now. We are seeing so many youth suffering from mental health, depression, and accessing mental health services because of that kind of differences. And again, not all the countries have been doing the same, faring the same. Some countries in the Middle East, my country in Egypt, for example, we did not have severe, let's say, strict lockdown. So people are managing still to come and go and enjoy, which is, I don't know if it's right or wrong, but at least people are, maybe it's because of also the education, let's say the public health education messages You may not have the best reporting of cases, but again, it's more about, the media, how they are passing the messages out, how people feel maybe, oh, nothing will happen to me, it's okay, I'll be okay. But then again, you have a massive amount of people who are affected here. But on the other side, youth are not subjected to this mental health pressure when you are completely locked down for months and months on end. You see, so it's very weird how the dynamics have been playing with the COVID response across the countries and the region and the global as well.
Absolutely, for sure. A common theme throughout a lot of these discussions as well has been what's been exacerbated from what have already been public health crises and human rights violations as well, which we will hopefully speak to as well later. But Dr. Hankins, sort of along with that, in terms of, or sort of despite additional issues that have been exacerbated, what new issues have come to light throughout the course of the year that perhaps weren't as relevant towards the beginning of the pandemic, or what are countries sort of having to deal with now that they weren't a couple months ago?
Yeah, so I want to agree with Simone that this virus, like HIV, is following the fault lines in society. So in the context of Canada, what came out was this incredible ageism. So what we saw in the first wave was that 80% of our deaths were in long-term care facilities where we had put older people with the worst paid healthcare workers in the entire healthcare system, with privatization, dysregulation, etc. So there's a major discussion in society to bring the long-term care facilities into the healthcare system. That was one. A second one was looking at what happened in terms of our opioid epidemic. And I assume something similar might have happened in the US, but we closed the border with the US. We did not have supplies coming into Canada. People were making their own in whatever factories. We've ended up having fentanyl overdoses big time, especially since people, were told that they had to isolate. So they were shooting up alone. Many overdose deaths that could have been prevented completely if we'd kept open supervised injecting facilities and other ways of helping people with their addiction. So I think if you pull back and look worldwide, what you see is major global health inequity in vaccine access, in access to diagnostics, in access to personal protective equipment. So there's a real push now to try to see both how do we get out of this one that we're in, but how do we prepare? And this is the discussion I'm involved in now in preparation for the Global Health Summit, May 21st in Rome. How do we prepare for the next pandemic and not get caught the way we are now with such a mess that's created all kinds of social, mental, economic, educational, negative effects everywhere? We've got to really learn lessons and learn them very quickly. So I'll stop there because I want to hear what others have to say. We're looking for solutions.
Absolutely. I think,
Sammi, sorry, I'm just going to quickly add to what Kate said, that in addition to getting out, we know as scientists, and especially environmental scientists, are telling us that because of climate change, we're definitely going to have these sort of issues, coming along. So as global health specialists and scientists, we really have to buckle up and figure out how to, as you said, Kate, to get out of this fast enough and be able to prepare for the next one.
I just want to emphasize what you've just said, Navid, that whatever we do to build back better and build back fairer, we have to do it in the context of the Paris Climate Agreement and the Sustainable Development Goals. We have to keep those high in our minds because these are the things that are so critical to the world.
Absolutely, completely.
and I think collectively, we've all had discussions either individually or together, how there's no sort of back to normal after this. We're not really at that point where everything is sort of definitely long lasting and involving many different sectors. Dr. Dajani, I'd love to hear your perspective, a similar question to Dr. Hankins, but what have you seen as successful within your region in response to the different issues brought to light, and how have these responses either adapted or changed as a result of these impacts?
Yeah, big question. I'll share different experiences, and from that we can learn lessons. Trying to avoid what has been already said, because many of the challenges are similar at different levels and maybe for different reasons. So I'm going to start with the negative and end with the positive. I want to reiterate that COVID has shown us the fault lines. I mean, we know our systems have problems, and everybody was, postponing, it's not important, or it's too big, too difficult, these are dinosaurs, we can't move them, we can't change them. And now we're facing this reality. And so, for example, in Jordan, one of the biggest things that we saw in terms of the negatives is because of lack of proper management and challenges with too much bureaucracy and red tape, where we had, similar to Egypt, a case where there wasn't enough oxygen tanks and some patients died. So it's just lack of good management, right? And enforcing the quality assurance and those things that people say, why should I do that? We've been like, really, everything's okay for the past few years. Why should I put that extra effort, that extra money in putting in procedures? So I think this is a wake-up call on what are those things that we weren't doing or we were not giving enough importance for that we should, even if, we have a saying that you have to plant for the future. You may not reap the benefits today, but you're setting it up for the future when you need them. So that's one point. And the positive of this, the silver lining here, is that all the excuses that prevented us in the past from setting up better systems, from putting in reducing bureaucracy, all those excuses are gone. Right? Nothing is impossible now. Everything is possible. And let's seize that opportunity. So every time somebody says, no, we can't do this, say, no, we can. Right? And we should do it. And now's the time. And if it's not now, then when? So that's one point. The other point is, the other thing is what was mentioned again is mental health, right? And staying at home and all those, again, mental health is not always brought up as a serious issue. And now we see that it is, and it's been exacerbated because of what has happened. So again, let's seize this opportunity. Let's talk about it. And here I want to point to the importance of the people, right? And the people through social media. Yes, we have the media that's governed by agencies or government, but we have the social media that can go either way, as we've seen in the United States. But it is our responsibility as citizens to try to shape that media and to raise awareness, every person from their position. And here, this is a call out to scientists, right? So what we've seen is a huge boost in science communication in the Arab world. I have been personally involved in a number of conferences all throughout the summer, last summer and the fall and this spring, of young people. And why young? Because the Arab world has a youth bulge. So we have a lot of people under the age of 30 who are in a way good educated and full of energy and unemployed, right? So I see that as a positive. And with everybody at home with COVID, these youth are coming up with all these ideas. And because of yes, internet is not accessible to all, but still people can share, and there is a rise in technology and access to mobile phones. There were conferences about raising awareness to science, all in the local language, all in Arabic, because I come from the Arabic region and we all speak the same language, and this is like 300 million people. And it was so heartwarming to see all these young people asking and inviting scientists to come and talk about science, not just about COVID and corona and vaccines, but about everything from climate change to public health, to water, to recycling. It was amazing. And so I see this is the silver lining, channeling all this energy. Of course, we will reap these benefits later. And if we're going to talk about immediate impact, when you raise awareness to science, you are helping reducing COVID, because people are now more aware. These young people will start talking and spreading this information. So these are some of the messages that I want to say, but I also want to allude to one thing, which is back to the refugees. I think coming from the Arab region, or developing countries, we've been through a lot. And what other developed countries are going through now because of COVID, we've been through in different ways. When you're in a war, it's like you're under lockdown. It's not COVID, it's somebody else doing something to you. So people are used to it. And which is, I'm not saying it proudly or in a good way, but I'm saying that That's why we were able maybe to go beyond and try to make it a better situation, try to bring up the positive. I mean, so talking of a solution, and when the education system shut down, schools shut down, yes, the government started giving out on TV for free all the curricula. UNICEF intervened and gave out tablets to everybody, regardless, refugees or non-refugees in Jordan. But then we had the teachers who are at home creating extra curricular activities to make it easier for their students. Or we would find in the apartment buildings, teachers gathering the students and teaching them, tutoring, or the high school students helping the younger students. So everybody was jumping on board. And I'm going to share my last story. So we have a program which is called We Love Reading, where we have been working since 10 years, training adults and youth to read aloud to children. This became such a great placeholder when schools are closed that at least we have parents and community members in their neighborhood gathering the kids on the apartment stairs, reading aloud to them, keeping the kids engaged, motivating them to learn because they want to, not because they have to. And maybe this is another silver lining, that COVID has shown us that maybe the way we've been doing things is wrong, that we need to go back to the roots and look for the root causes of the challenges we're facing. And say for education, it's about motivation. It's not about getting kids by force into school. It's about motivating them to want to learn. So they seek those opportunities and change the school system, for example, to go beyond the classroom wall to become lifelong learners. And one refugee who we trained in the Za'atari camp, which is one of the biggest refugee camps in Jordan. So one of these women who we had trained back in 2014, and she still reads aloud to the kids. So I called her on the phone during the pandemic, and she said, first of all, they locked down all the refugee camps to protect them, because when the first wave came, they were clean. There was no COVID cases. They just started increasing recently. And she was so happy. She felt so grateful that she was protected, she was safe, and she saw what was happening in the government and people closing. There's no perfect government. There are things that are done bad, there are things that are done good, but let's acknowledge both, right? So we can clearly say what is wrong and stop it, but clearly say what is right and celebrate it. She was so happy that she felt protected, not like in Syria where she was bombed for everything. That she, as a refugee, her name is Asma, started collecting money to support the Jordan government so that they could keep on doing the good measures. So to me, this is citizenship. This is feeling of belonging, that I want to do what is right when we all come together. And so I think one of the questions, I was looking for the questions really quickly, is like, how do we do this? How do we spread this spirit? And I think it's about telling stories, sharing role models, and every person thinking, I can do a little bit, and to go and do that.
Yeah, absolutely. Something I always hear from Dr. Madani in particular, and my advisors, is to recognize your own power in doing positive change, which will definitely, as you previewed the questions a little bit, circle back to as well. And particularly public health education is something that students are asking a lot about as well. I have one last sort of response question for Dr. Madani to pose regarding previously mentioned HIV, even Ebola outbreaks. How does experience with previous epidemics, pandemics, or diseases influence regional response to COVID? So where have we applied these previous instances, perhaps not just as it relates to science, but addressing stigma and associating policy action as well?
So I've said this in the previous talks I've given, and I gave a talk about 6 years ago, actually, now in California, that I talked about the influence of HIV and what HIV did for sciences in general. First of all, before HIV, we didn't have advocacy. HIV opened up advocacy, like people, did we talk about breast cancer before HIV? Like, did we have a breast cancer month before HIV, or colon cancer month? No, HIV really brought a lot of things outside of the box. And one of the things it did, and as a scientist, we were, again, before HIV, we were kind of islands. We did our own thing. I have, colleagues who've worked on, ATPases for, years long, But with HIV, what HIV did, and because of the epidemic, and because of how the epidemic really stigmatized people, and it put people in their own boxes, as scientists, we started collaboration. The collaboration, immunologists worked with virologists, virologists worked with biochemists. I mean, a few years ago, I had a paper that there were 16 people on the paper, and they were coming from all different sorts of background in sciences. So we all held hands and collaborated so that we can find a cure for HIV, which we don't have yet. HIV is the most studied virus to date that we don't have a vaccine for. So now when I look at COVID, especially last year this time, COVID science was moving in such a fast pace. Like in real time, we were seeing, papers get published. All of it, I believe, and Kate, you can tell me if I'm wrong. I really think all of what we were able to achieve with COVID was on the shoulders of HIV science and what the HIV scientists have been doing for the past almost 40 years. So that's as far as the science of HIV and everything. But another thing HIV did, like I said, bringing out of the box ideas and everything, and that's something that we have to do. We have to revamp that. And Rana talked about some of these outside of the box ideas that are silver linings, and that is raising awareness. At the beginning of COVID, there was wonderful, information, blogs, and in social media, but unfortunately there were a lot of wrong information as well. So that's something, especially among elderlies, let's say, and at least some of the ones that I remember were in Middle East and North Africa, because in different social media mediums, I would get emails that were, is this right? And I kept saying, make sure people represent themselves right, make sure they are physicians or scientists, they say where they're coming from, what's their name and everything. So that's something that, with the pandemic and the way it started, we were almost like, these surfers that before we came up, we had another wave coming in and we had to get up and, breathe again. So, learning from the waves of last year, I hope we put together a global pandemic response based on like custom made it to different regions and, and have it out there. But something else that also Rana said, that with regards to Jordan, they did some things differently. For example, I have a feeling that because Jordanians and also Iranians, in general Middle Easterns, and also Southeast Asia, for example, in Southeast Asia, they decided to vaccinate the young first before they vaccinated the poor, because the transmission was going mostly from the young to the old people. But in Middle East and North Africa, the elderlies became the caregivers, the caretakers. Their homes were open. They would take the kids in, making sure everybody's negative, so they would take the kids in, and they would educate the kids. And that's something, Rana mentioned stories. I mean, growing up, I loved hearing stories from my grandparents. And in this day and age of really fast, everything was fast, COVID caused it to kind of be all slowed down, especially in the first couple of months of COVID. And a personal story that I have, both my husband and I being scientists and having to work and not having help, we don't have family around. So a couple of my, friends that, were retired, they started having weekly Zoom calls with my kids. So at least around that time that, they have, they're either doing sketches or they talk about books or, whatever the kids were occupied. Because one of the things that we did see here was, in general, because women are, more caretakers at home, the percentage of publication for women scientists during the latter half of last year really declined compared to, and that is directly related to the fact that, women in general take care of the kids more at home. I think one last thing I wanted to address here is lack of infrastructure. In the last 30 to 40 years, unfortunately, we have seen a lot of unnecessary wars, and unnecessary is kind of, not a correct word, because when are wars necessary? Rarely. And I'm really hoping that we have our leaders start thinking about that, when a virus happens in one part of the world, everybody else, we don't have borders right now, and viruses don't see borders. And right now, I know President Biden is really putting a lot of money into infrastructure, because, even our healthcare infrastructure in the United States, as we've seen it because of COVID, we see that it's not as strong as we thought it was. And if some places in different parts of the United States are resource limited areas of United States that's very similar to some parts of, let's say, Africa or Middle East and North Africa. So I am hoping that this pandemic really taught us to invest in infrastructure, whether it's education infrastructure, healthcare infrastructure, and invest in our youth. This is crazy critical right now, investing in our youth and being able to bring out the spirit of hope in them, because the last few months, the last 12 months has been really, really tough. And Sammi did mention, what I usually say, to our, group, our team, is that this is not a sprint and this is not a marathon, but this is an ultra marathon relay that we have to, persevere and give the baton to the next generation and next generation on. I'm going to stop there.
I think a great overlap of infrastructure and youth empowerment, as you mentioned, is education, public health education, which is what I wanted to circle back with that Ms. Salamps mentioned. And I'm hoping, Simone, you can expand a little bit on what public health education currently looks like for COVID on a more global scale, sort of the limitations associated with this. And then some students are also wondering for that clarification on the aspect of gender discrimination, wherein boys might return to school sooner than girls would, and how this might ultimately impact public health education as well.
I think it's all, thank you very much, Sammi. I think it's all related. I want to also go back to the linkages between HIV and the COVID in that angle as well. What have we learned with HIV? HIV is also gave us the impression that we cannot work on the AIDS issue or like an epidemic at the time without looking at so many other parts of the whole response. It's not just health, as we all know. It's social, it's economic, it's educational, it's cultural, it's all of that together. So seeing the same thing in the COVID, it's not just public health education, but it's public health education with looking also into other, enablers, societal enablers that we have never been talking about before. And I think HIV gave us this, aspect. And what we have been seeing in terms of the vulnerabilities in the COVID has been hitting mostly these people who are mostly left behind, like the poorest, the most marginalized. If I might say, if we're talking about the community of HIV, yes, the LGBT community. If you go to the lockdown, who are the most, petrified by the police in lockdown? It's usually those communities who, are harassed, and violations are happening because they are, sometimes the law enforcement would look at them and take advantage of them being from this community, and make it worse for them to be out of in the streets. So what I'm saying is that it's everything together. We are not speaking about only proposing health education in terms of giving them what does it look like to be preventing the COVID response, what you need to do, what you need to be taking, what kind of vaccines, although this is very important. And one thing I think the HIV taught us as well is with the advocacy came a lot of treatment literacy. So the HIV people, the people who are living with HIV, those who are most concerned are very much educated in the HIV response. You'll find them knowing everything about the HIV transmission, the medication, what they should be taking. They are supporting one another. Part of the adherence is because of these community support groups. And I think with the public health education within COVID, it's also this kind of support, what Dr. Madani was saying, that we just needed to make sure they have the right information to be sharing among one another. But it is, but the let's say the willingness to be sharing information and bringing themselves, forming themselves together in community support is really amazing and something we have been seeing. I think also in terms of to go back to the question about gender equality, this is one of the main things we have been really seeing in terms of education. For example, I'll give you the example of the Ebola. The Ebola in DRC, for example, in the Congo, when it hit, it really worsened the situation of violence against women, but it was never addressed later. So whatever the ramifications of the Ebola in this country was never addressed. And this is why when COVID hit, it was you know, like we are building on wrongs that have not been righted at one point. And this is why I'm saying that when it comes to education, when it comes to access to schools, I'm speaking also about you know, countries in Africa where it's not easy for the girls to be going to school. But let's say the schools are closed or the schools are coming back and it has to have a capacity. Who are they going to be choosing? Of course, the boys will be the ones who will be going and the girls will be staying home. And this is going to be also affected later on as we move into other vulnerabilities, because when you get education on prevention, you get education on how to protect yourself, how to, you know, take care of yourself and all of that. So it's all linked. And then vulnerability to HIV and to other infections or other, you know, violence and so forth, and child marriage, and, you know, the whole circle comes. The other thing I wanted to also speak about is the societal enablers. I'm just giving you a very small example. When we in MENA, when I was the focal point for COVID, we were working with WHO on the Global Action Plan. You know, the Global Action Plan had 7 accelerators. The two most, I have to say, debated accelerators with the partners when we were working were the engagement of community and the socioeconomic determinants of health. People are not used, and I'm saying here, all of us, in terms of partners working together, we are not used to community-led. The language is new to us. Maybe community-based we can accept. Yes, we want to work more with communities, we want to give them, to empower them. But community-led is what is really the essence of the whole response that we would like to see. So if you want to really educate, public health education, you need to fall on these community-led, you know, initiatives and responses. The socioeconomic determinants, of course, I mean, we will not be able to work on the COVID response without being able to tackle the social protection, the food security, the poverty, and it has to be equitable, because if you go through all our countries, I mean, in MENA, in the region, we do have social protection schemes in all countries of the region, but are they providing social protection schemes for all populations? No, I'd say that some definitely are left behind. The countries that are supporting one another, if we are in a region and countries are providing support to their communities, as are all the countries supporting at the same level? No, some countries are receiving, some countries are not. So it's the whole inequality that we need to address. And the education here has to be, we have to be discussing all these sorts of angles when we are working around COVID. It's not that bleak, huh? We do have some kind of best practices. We do have some things that we are very happy to share. Like, for example, I'll give an example and something from the region, the LGBT community. You know that this year, although it has been the hardest for most of the communities in the interventions on reaching out to population, it was the first year that we had a transgender assessment led by transgenders in the region. And we're seeing that we are getting much more response in moving forward with implementation using funding from our global partners. So sometimes when it's the worst, we get the best, you know, advocacy efforts. just to over.
Absolutely. And something you mentioned earlier, sort of the accuracy or even relevancy of sort of the information that is being put out there. And something that students are asking, I think, Dr. Hankins, if you wouldn't mind speaking on this, is the issue of misinformation or rapidly changing information. We also had people bring up sort of the recent pause in the Johnson & Johnson vaccine, for example, and how that impacts sort of international vaccine distribution. How is information either controlled or regulated to the extent that public health education then can be trusted and reliable?
So you just said the key word, and that is trust. And the issue, you have so much misinformation, you have explicit disinformation going on. You have people with confirmation bias looking to get confirmation for what they already believe, that masks don't work, that the vaccines cause problems. We have a major problem worldwide on this, absolutely. So, just reflecting a little bit back on, how you can help to overcome this, I think co-creation of approaches, of messages at the geographically specific level of communities that's going to be what's going to overcome this. So for example, our vaccine rollout has gone very well in Indigenous communities because those approaches are co-created. They decided where it would happen, how it would happen, who would go first. Is it the elders? Are they showing the way? They actually helped and that it makes such a huge difference in the sense where we're having many things imposed. We're having lockdowns, curfews, etc. imposed. The more that people can be empowered to create what they need. And I argue that HIV has taught COVID, basically. HIV science has taught COVID science that when you co-create together, you get the right questions being asked. You get answers that then are relevant for communities and for people to move forward on. So that's a big HIV one. I was going to say this isn't related to this, but I did want to say that we have a lesson from Ebola that we're actually using here because we're seeing the fault line of the virus that the virus is following is that it's going into low income, racialized communities in mandatory, essential public-facing jobs who are having to go and to do the work that gets food on the table for everybody else with not enough protection. So we're moving from a strategy that made sense in the beginning with vaccine rollout by age and vulnerability into one that now addresses work site, geographical hotspots. Anybody over 18, you live in a postal code, you can get access to the vaccine to try to address what's actually happening as opposed to the way we started, which you had to do. We have a huge decline in hospitalizations and deaths among older people now because of what we did in the start. But now we've got variants circulating. Somebody asked about them. They're at least twice as infectious. They move very quickly in your population. So we need to find strategies that actually, and you can't do those by not working with community. You need to work with community to figure out how you're going to roll out the vaccine in the community. So that wasn't quite the question you were asking, but I think trying to deal with, I think that one of the biggest trouble is trying to deal with disinformation. Misinformation, you can help people understand better, you can help correct. Disinformation, you really have this issue of how much do you give it air and highlight it if you face it head on, like what can you do? So I think these are big challenges.
Absolutely. And I'm hoping we can maybe weigh, Dr. Dajani, between the sort of community-based approach that you were referencing before with the international component. So where and when do countries or regions sort of choose when to take more of an international collaborative approach versus focus on perhaps their more local community impacts, and sort of how have these action steps been taken differently and to what successes?
Yeah, no, thank you for that question. We need to have government people here on this panel to help answer that question, but we can talk, we can advise of how it should go out. And again, I'm not a politician, and I haven't held government office, but I can share the perspective of the street in Jordan and what I've heard in the MENA region, and also I think from other countries around the world. But again, disclaimer, this is my reflection. I think it's always a tension, right? Now I'm talking about COVID. As a country, you want to lock down because you want to protect your people. So you're going to close borders. You're going to put people, make sure everybody is closed. Now, how strong your community is will be reflected by agreeing to these measures of lockdown and actually supporting them and encouraging them to happen and coming up with solutions to help people through the lockdown. So one of the questions was about, what about food? What about shortage of water when you locked down? Well, no, the neighbors were giving bread. The army was handing out food to people. Elderly were being taken care of. Somebody who knew their neighbor was an elderly went and got their groceries. So you're as strong as your community network is. And I think building on that, strengthening that is important. That's how we evolved as a species, by the way. We've just forgotten about it. We've gotten caught up in technology and modernity and all that. And we've forgotten about the fundamentals that COVID has reminded us, brought us back to the basics. Like, don't be arrogant, human being. In the end, you go back to your roots and that community. Now, going to the other part of your question, international, right? So again, there are commonalities, and people, as much as you lock down, people are going to keep on going back and forth. And also, if you're talking about regions, you have shared challenges, shared culture, shared communities. And so one thing I think did not happen enough, at least to my knowledge, is sharing of the learnings and the good practices, say, among the Arab countries, because we share so much, right? If Jordan said, this is what I'm doing, and Egypt said, this is what I'm doing, and then we can learn from each other, or to really honestly come up and say, hey, we did this wrong. But we're going to fix it, right? To own up. And I think that takes courage. And that takes feeling that the community will support you if you come up and say, I did wrong. So it all goes back to the word, I think, who mentioned trust. It was mentioned more than once. Catherine mentioned it, I think many more. It's about the word trust between people, trust between government and people, and then trust internationally. So speaking internationally, going beyond the region now, going globally, I think what COVID has reminded us, and I said this in the beginning, is that these apparent disparities and differences between us are artificial. In the end, we're a human biological organism, and a COVID is going to hit me as much as it's going to hit the richest guy in the world. And so we both should really care about this. And I think if we highlight that, keep that in mind, we can start looking at system change. This was mentioned more than once, that the problems we're facing today in every sector that have been highlighted by COVID, to me, it's like a wake-up call. It's a shake. Like, the systems have been wrong. The framework is wrong. The system is wrong. We are seeing it now. Let's start with a different framework that starts with the human being, that starts with the community and the networking. And I believe there's a chance. Now, there's a lot of things that have been happening. We may not see the benefits of them now, but I believe that we will see later down the road, I don't know when, 10 years from now, maybe another generation, where what happened now, how people were impacted, will have something positive is going to come out of this, from this memory, from this shared experience within your local neighborhood, or even to the level of the globe. That is unprecedented, because when the flu epidemic happened, we weren't connected through media and social media like we are now. So I believe something good will come out of this. Retrospectively, we'll look back and we say that was the pivotal point when change happened. And I want to urge people, there's a group of social entrepreneurs that formed right at the beginning of, right before the beginning of the pandemic. It's called Catalyst 2030. It's a group of stakeholders who've come together who want to make, to push the SDGs, because I think the calculation is that we won't reach them till 2094 or something, to try to work together to push them. And not because, people may have issues with SDGs, it doesn't matter. It's about we're working to make a difference in this world. So I urge you to be members with them, watch them. The Skull Social Forum is happening right now, and it's open, free. Again, because it's on Zoom, Before, you'd have to buy a ticket, go to Oxford, and pay your fees. Now it's open for everybody, so anybody can go and watch. So, so I think that those are important points that we can highlight and take advantage of. Hopefully, I answered your question.
Absolutely, and I was going to say it's a great sort of transition into the more concluding section. It's almost like we talked about this before for the last year, but I think as we sort of wrap up the discussion, unfortunately, there's just never enough time with so many amazing ideas shared. Those last two ideas that Dr. Dajani talked about, sort of lessons learned and steps forward, is always super important to leave with, just as students watching, individuals going into the public health sector eventually, what this sort of response will look like. I'm hoping Dr. Madani and Ms. Salem, in the last sort of like 5 or 6 minutes we have, I would ask the two of you to sort of talk about the biggest maybe lessons taken away, and then I'll have Dr. Hankins and Dr. Dajani conclude with perhaps some community level steps forward. So we can start with Dr. Madani.
Okay, that sounds good. I was actually answering one of the questions that Max had sent, and I'm gonna read it aloud since I can't type anymore. He asked if countries should be collaborating to improve conditions of the pandemic. Should the US be doing more to facilitate vaccine rollout to other nations rather than favoring their own citizens first? So that's actually one of the things I wanted to talk about in answering Sammi's question. And I think the priority right now, we really have to pay attention to global health and global partnership. And Rana and Kate talked about trust, initiating and selecting leaders that people trust, and they trust each other to put forth a package of instructions of what we have to do now moving forward, and also what we have to do when the next pandemic arises. So in answering Max's question, I was writing a paper a couple of days ago, so some of the numbers I still remember. U.S. has spent 200 million doses in U.S. and only 4 million of AstraZeneca that we weren't going to, I believe we weren't going to use in the U.S. Has gone to Canada and Mexico. China has used 250 million doses for their citizens, and 118 million doses to 49 countries. And Russia has sent I don't remember the doses, but has sent vaccines to 22 countries, and India has used 150 million shots for Indians and 64 million outside. So we are, Americans are definitely lagging behind in global partnership and global, let's say handshaking to be able to, fight this pandemic. I think that was unfortunately part of our leadership in the past few years, and I hope that changes by, like Kate mentioned, going back onto Paris Accord and bringing in, our international partners, not only to fight, different pandemics that are coming along, but also climate change and other epidemics that are going to be around the corner. I hope I know we don't have time. I'm going to give it to Simone.
Thanks, Navid. I think just one recommendation based on Dr. Rana had said, I think we need to document what you've said as experiences from Jordan are amazing. And I'm sure across the world there are. We always looked at the COVID in terms of science, what we are doing, what figures and numbers, what had reached, who had reached what. But I think the personal stories, the local context is very much important to bring out. Now, on lessons learned, I think what we really need to also piggyback on, and again, I go back to the HIV response, is the coordination. And what has been said, definitely the global cooperation, but how could we make use for what we have been lacking in the HIV is by that we lost 10 years until we realized that we can manufacture, ARVs from the countries in the developing countries. 10 years until the Global Fund and PEPFAR came over and said, hey, we can support the ARV for the low-income country, because it was only among the elites from the high upper income country to access that. Taking the same lesson from the for the COVID vaccine, I think the opportunity coming now is something like the G7 that's coming up in June. Let's push, let's advocate that, you know, the alliance, the People's Vaccine Alliance can push for a proposal to ensure that patents can be waived and countries from the developing countries, they can manufacture the vaccines. This will make a lot of difference for the way forward in terms of vaccination. The other lesson learned, and I cannot emphasize it enough, is equality, working around equality. I mean, the UNAIDS global strategy, I know it's built around the inequality framework, but it's the first time, and I'm so happy and proud that we have targets on stigma and discrimination, punitive laws, gender-based violence. And I think this is where we all need to be pushing, how we can make this implemented, learning from whatever we have in terms of evidence-based interventions. And we have plenty. I mean, I can share later some evidence, the guidance we've put together in UNAIDS on such, you know, stigma and discrimination within the COVID, how we have learned from the HIV. And I stop here, but I'm really happy because I just want to say that I learned a lot from all of you today. And thank you very, very much.
Thank you, Simone. I'm going to have Dr. Dajani jump in because I know she has another talk. We're so lucky to have her for the time that we do. Thank you.
No, thank you. I've learned a lot from my fellow panelists and from the wonderful, amazing questions from the students. I've read them all. I went through them all. I know we weren't able to answer every one of them, but I think hopefully we've touched on different aspects. And please feel free to email us later. Our email, at least from me, my email is shared, and you can follow up with any questions you want or have. I'm going to say two things. One, I want to jump off what Simone said about equality and justice, and how do we do that? How do we help that happen? One of the and to really listen and respect and understand the nuances and not just take the face value of things. And I need to allude to this because this was one of the questions about the vaccine rollout in Israel. It got a lot of hype and a lot of media. However, and these are facts on the ground, that the Palestinian community and population within Israel and within the West Bank that is under the mandate of Israel has not been given the vaccine at all. So yes, they were able to do it for their own population, but the people who work there, the paid laborers who go in through checkpoints and walls, who cannot even get access to a hospital, are not given the vaccine. So we need to be careful in these lessons as we promote lessons to make sure what is it about. Of course, if you have a little group of people in a confined space and give everything, you're going to be able to succeed. The issue is how to be fair, how to give it to everybody who deserves it and who needs it, regardless of who they are, where they come from, and so on. And I think that's something, and Jordan has done that. It has given the refugees similar to anybody else. Of course, there are other challenges. Nobody's perfect, but we need to be careful of that. And I just raised this because this was one of the questions that was in the chat. I will end by saying that, you know, each one of you, the students who are here with us and anybody who's going to hear us later, is that everybody can do something. You know, every person is unique. They have their own DNA. Epigenetically, even two identical twins are different. So you have something to give to your community, starting from yourself in your local community. And it's the butterfly effect. It's the chaos theory in physics that you will make a difference. When a butterfly flutters its wings, it moves the air a centimeter, but it results in a change in time and space beyond what you can imagine. So trust in yourself, you know, believe in yourself. If you have a good idea, just go out and do it. Now's the time, right? And if you don't do it, then we can't, you can't blame people later, right? So go out, do it, trust in yourself, and nothing, COVID has shown us, nothing's impossible. Yeah, and thank you very much, everybody. And I'm sorry I have to leave because of my second talk, but take care and assalamu alaikum.
Thank you. And Dr. Hankins, any final thoughts for our audience today?
Yeah, just encouragingly, there's a big meeting going on right now on manufacturing in Africa with the head of the African Union, the African Development Bank. We're going to get some movement on this because this is insane that we haven't been able, I mean, that Canada can't biomanufacture. Okay, we can see if we can negotiate vaccine doses, and we don't like not being autonomous. But Africa has got to be autonomous in terms of being able to not just do the fill and finish, but actually the whole production chain for vaccines. So I just thought Rana's comments were great for the audience. I haven't been able to look at all the questions, but I've copied them all so that I can look at them on my own tonight. But you guys are such a vibrant group. I mean, I'm hoping that you can find ways to continue these discussions together, because we're not out of this. Tony Fauci said yesterday morning, it's not going to be a light switch going on and off. You know, we're going to talk about return to normalcy, or whatever he called normalcy, is going to be incremental and so we're going to have to build it and make it the way that we want. It is an opportunity and we need to take advantage of that. So I just want to thank everybody. I learned a lot. This has been a great panel. So Sammi, thank you so much for pulling this together.
Thank you. And as you just reiterated, maybe a year from now, we'll regroup and see where we're at then. But thank you, Dr. Milich, too, for letting me host here.
Of course. Thank you all so much for being here. This was really wonderful. The students are putting lots of messages of thanks, and we can send all of the panelists the questions from today. We'll get a downloaded copy of those and send them to you so that you can have a look through. And certainly if there's anything that you want to follow up about, our students are very active on our Canvas page. We have lots of discussion boards, so we'll keep the conversations going there. But I do want to sincerely thank all of you. As the students noted, this is a very impressive group of people, and we so appreciate you taking the time to speak with us. And I personally want to also, of course, thank you as well. This has been wonderful, and you've given us so many important messages and information for us to think about and talk about in the future. So thank you very much.
Thank you.
Thank you. And to everyone else, we will see you next week. Until then, stay safe.